Hi, Rory here, and in this video I'm going to be talking about cognitive behavioural therapy and explaining some of its functions. And don't forget to like, comment and subscribe. Cognitive behavioural therapy explained. In this video you will learn about the founder of cognitive therapy, the philosophical underpinnings of cognitive behavioural therapy, or CBT as it's known, the psychological schools that are the roots of CBT, what CBT is effective for, the CBT counselling approach, the CBT processes of change, and the advantages and disadvantages of CBT. And if you want a free handout, all you have to do is click the link below in the comments section and you'll get a free cognitive behavioural therapy handout. The founder of cognitive behavioural therapy was American psychologist Dr. Aaron T. Beck. He was born in 1921 and he died in 2021. And he's really considered the father of cognitive therapy. He developed the treatment after finding that his depressed patients frequently experienced distorted thinking, and he named those automatic thoughts. So let's have a look at the philosophical roots of cognitive behavioural therapy. Well, one often talked about philosopher is Epictetus, who was a Stoic philosopher who said, men are disturbed not by the things which happen, but their opinions about the things. In other words, by altering our view of the situation, we avoid difficult feelings which can impact on how we behave towards ourselves and others. So thoughts create feelings, feelings create behaviour, and behaviour reinforces our thoughts. So if we can intercept those thoughts, challenge them, may look at things from a different perspective, our thoughts will change, our feelings will alter, and consequently our behaviour will change. So which psychological school does cognitive behavioural therapy come from? Well, CBT can trace its roots to two distinct schools of psychology, behaviourism and cognitive therapy, which subsequently merged. And just as a reminder of the schools of psychology or therapy, there's three distinct schools. The first one is psychoanalysis, which of course is Sigmund Freud and his work. The second is behaviourism, and CBT fits into that. And of course, the third is humanism, most widely recognised for person-centred or client-centred therapy. So what is CBT effective for? Well, CBT can help with obsessive-compulsive disorder, phobias, panic attacks, borderline personality disorder, and depression, just to name a few. So what about the counselling approach? How does the counsellor approach and use CBT therapy? Well, a CBT therapist will help a client deal with overwhelming problems by breaking them down into smaller parts. Give the client ways of changing negative thought patterns to improve feelings, and help the client build a psychological toolkit to apply between sessions and after therapy has ended. Let's have a look at the process of change in cognitive behavioural therapy. CBT is based on the concept that your thoughts, feelings and physical sensations and actions are interconnected, and that negative thoughts and feelings can trap you in a vicious cycle. CBT aims to help you deal with the overwhelming problems in a more positive way by breaking them down into smaller parts. And don't forget, if you want a free handout that explains CBT and cognitive behavioural therapy in greater detail, click the link below in the comments section to get your free handout. So what are the advantages of cognitive behavioural therapy? It can be completed in a relative short timescale compared with other talking therapies. It focuses on retraining thoughts and altering behaviour to influence more positive feelings. And CBT's structured approach means it can be delivered in different formats, including in groups, self-help books and computer programs. But what about the disadvantages of CBT? Well, attending regular CBT sessions and carrying out homework between sessions can take up a lot of time. Critics observe that CBT only addresses current problems and focuses on specific issues. It does not address the underlying causes of distress, such as an unhappy childhood. To benefit from CBT, the client needs to engage in the process and commit to the model. And finally, don't forget to click the link in the comments bar below to get your free handout on cognitive behavioural therapy. And finally, thank you for watching.